Hi friends. When somebody comes in for Kybella as a consult, this is kind of what I say is my spiel. Kybella is FDA approved under the chin for submental fat. It is deoxycholic acid, which is an acid that goes into the fat cell and causes an Alka-Seltzer type reaction to the fat cells, so they bubble over, and that fat cell then breaks the cell membrane, kind of like popping a balloon. And once that cell membrane is broken, it's dead, and then your body's immune system washes it away over the course of a month to a couple weeks to a month. Kybella is great for small areas and for precise areas. It causes a lot of swelling because of that Alka-Seltzer type reaction. So I tell people you're really going to feel like Jabba the Hutt, like you're going to move and your chin's going to shake. And it's going to feel a lot of fullness there. So you can't hide it from people. It's great during the fall, winter when you can wear a scarf. It was great during mask season. It was very easy to mask. So I like to preempt any of my conversations with Kybella to let them know swelling is a non-negotiable. Because you're using a needle and you inject at points 1 centimeter apart, it's very precise, so you can get small areas. So cool sculpting is also a fat buster in the chin, and you guys know how that works. It's similar. It's a physical reaction with cold instead of a chemical reaction with the deoxycholic acid. So it's two different approaches, but the outcome is the same. 1 round of Kybella and 1 round of cool sculpting aren't similar with results, as in cool sculpting is more of a debulker, so it will take more of the fat cells with 1 round than Kybella. So I usually tell people you need 1.5 to 2 rounds of Kybella for every round of cool sculpting. So those that have a pretty good double chin, I usually recommend let's start with cool sculpting, maybe even do a second round, and then we'll move to Kybella if we need to. And that's because not only will they get quicker results with cool sculpting with less downtime, but it's also less expensive for a better result. Kybella comes in when somebody comes in and says, I have this little thing here, and then I've got some things here, and around the mandible, I can't get the cool sculpting machine to stick onto that angle. So Kybella is awesome for jowling that's starting. It's great for a little bit under the chin. Even then though, I do sometimes say, let's do 1 round of cool sculpting and then go in with Kybella. Because if I can do anything in my power to reduce the amount of Kybella they need, it's going to be better for their wallets. That being said, if somebody's either sold on Kybella and wants to do it, or they really just have jowls, or they really just have this little blip, or they have a very small jawline where I won't be able to get the vacuum. So when you take that cool sculpting guide, the blue one, and you put it up onto their chin, if there's no bulge of fat in the middle of that guide, it's not gonna stick. So you need some sort of bulge in that guide for the vacuum to stick. So with Kybella, it's an injection. Some people ask how many injections. I usually don't go there, but if they do ask, I say it's 1 every centimeter, and usually it's either 10 injections or 20 injections or up to 40. We use a topical numbing. The injections themselves don't really hurt. What hurts is when the medication starts that reaction, which takes like 30 to 45 seconds, it starts to burn. The rep will call it a spicy feeling, but sometimes it really, especially 2nd, 3rd, 4th treatments, it really hurts. So you need to have an ice pack all ready to go. So the way I do it is they have the guide with the dots. So Kybella comes with a guide that shows you exactly where you're going to inject, and you're injecting at a 90-degree angle, and you're going in, your depth is a 1/2 to 1 centimeter in the middle of the fat. And the markings, which are all in the video, will mark out the edge of the mandible to 1 centimeter so that you're not getting the marginal nerve, the marginal mandibular nerve. If you do get Kybella into the marginal mandibular nerve, either around or actually inject it, you can stun that nerve, and when they smile, one side I'll kind of go like this. That's always temporary. You've sheathed the nerve with the deoxycholic acid, but it grows back. So I warn everybody about it. It usually happens only when you're doing jowls, because you're on the area you're not supposed to do. And it's happened a few times. It's definitely happened a few times. The median time it lasts is 2 weeks. There's nothing they can do to make it get better, go away faster, other than icing, because icing will make the swelling go away faster, and that's partially compressing on the nerve as well. But we do like swelling, because swelling means it's working, and swelling means all those immune cells are going straight to where the medication is working, and they're taking care of those dead fat cells. So once you have the tattoo on to mark where you're going to inject, you count how many dots you want to do. So you circle the area. Let's say we're doing jowls. You circle the area. You put the tattoo on. You count how many dots are in the circled area, and that, using the guide, which is in the Kybella, in the room that we do Kybella in, will tell you how many mLs of Kybella you're doing, because each injection takes 0.2 mLs of Kybella, and this is something you'll probably forget, but it's in the paperwork for a reason, and it's in the guide for a reason. So 0.2 for each dot, and there's 2 mLs in each bottle. Each bottle costs a patient $600. So, like I said, if we can minimize the amount of Kybella. But if you think about it, a jowl needs one bottle. A jowl needs 1 bottle. So 2 bottles, so that's $1,200. So if somebody's treating jowls, I always say $1,200. 20 dots, 10, 10. And then you'd mark that in the chart. For chin, really you need at least 2. And if you're trying to carve out a bit of a jawline over here, which I recommend because you're going to get a better result and people are going to be happier, you'll need 4. 1, 2, 3, 4 bottles. But it's all about the number of dots. Kybella is one-time use, single-use bottle, so you can't split it. So you want to, if you have any extra, let's say you only have 15 dots and you need 20 to sell that 1 bottle, you need to find more dots. And there's always more dots. There's always more fat than you can imagine. So after you mark out the dots and figure out how much you need, prepare your syringes. You're going to do it in 1 ml syringes with a 30 gauge needle, with the intention of doing 5 dots per syringe, because each dot is 0.2. 1 ml takes 5.2 aliquots, 0.2 aliquots. And each bottle of Kybella will take 2 of those 1 ml syringes. So this is all jargon. Obviously, once you get your hands dirty, it'll make more sense as to what I'm saying. So you prepare your syringes. They're numbing. They still have the numbing on. They have the tattoo on. They have it all marked. And then you're going to grab 2 ice packs. And then you're going to start injecting. And you're going to do it in a slow, controlled manner, but try to do it as quickly as possible. So I know that sounds kind of funny, but I tell people that I'm going to try to go as fast as possible with being precise, because the faster you do it, once that medication starts working, 30 seconds in, they're going to start getting really uncomfortable. So you really want to start with one side and then do the other. You don't want to jump around, because once one jowl is done, you can give them the ice pack to hold it. The ice helps a ton. So give them the ice pack on one side, and then you can work on the other side. Once you're done, and the injections themselves are super easy. It's just an injection. Once you're done, you have them sit with 2 ice packs. It takes about 5 to 8 minutes for that reaction to dissipate. And then they're left feeling sore and tight, but it's not intolerable. The part that can be intolerable, especially without ice, is the part where the medication is actually working. And that's only for 5 to 8 minutes. So I tell people it's going to get worse, worse, worse. I usually stay with them for a few minutes just to make sure they're not going to pass out or get nauseous and throw up. And then I tend to leave them in there with the ice packs so that they can kind of close their eyes and focus on getting through. Obviously checking on them, but it's a lot of times they have to focus and not talk to you because they just need to get through that, as the rep says, spicy feeling. Once that's over, they're good to go and they can set their follow-up. With Kybella, we can inject once every 2 months. So we'll get before photos, big thing. You don't have to get a weight. I'm never gonna scowl at a weight, but you don't have to get a weight. And then you schedule them for the 2-month follow-up where you get photos, and then you always want to set the precedence before you start Kybella that you're going to need more than 1 treatment. And you may need up to 4. Usually they don't need up to 4, but they definitely need more than 1. So you plan out the 2 treatments. They always get 25% off the second, third, fourth treatment. So let's say you did 2 bottles, which is $600 each, $1,200. They get 25% off the second treatment, which is $900. So it's something you discuss in the consult. And then you just inject the same area. You don't have to go with exactly where you put it the last time at that 2-month mark. You don't have to do the same amount at that 2-month mark. If they have less of a surface area, you can try to consolidate into, 5 dots. I rarely find, until you're at a 3rd injection, I rarely find you can do 5 dots. You really need to do 10 for jowls if you're going to treat it appropriately. There's no real contraindications. People who have any immunocompromised state, cancer, any cardiac problems, chronic autoimmune disorders, they all probably need to be cleared by their primary. So if there's any medical conditions that pop out, is not the norm, asthma, depression, just let me know. And a PA will be reviewing it prior to. Blood thinners are not a contraindication. However, if they're on an antiplatelet like aspirin, they're going to bruise pretty significantly. So you have to make sure to tell them that. Again, you'll have to tell them about the smile. You want to make sure to inject at least 0.5 centimeter into the fat pad, because if you inject too superficially, you can cause some skin thinness and necrosis. But as long as you're injecting at the appropriate depth and into a fat pad, there's not a lot of long-term complications with Kybella. It's actually a really easy and kind of fun thing to do. The hardest thing is preparing the syringes. It takes forever. It's like Quo. All right, so contraindications, obviously pregnancy and nursing. Stroke would be a big contraindication, recent heart attack. Surgery is not a contraindication, but I like to wait for any of this stuff, more invasive stuff than like a hydrofacial, a good 2 months post-surgery. Cancer, like I said, is not a contraindication, but I'd like them cleared by their oncologist. You definitely need at least 2 treatments, if not 4. For jowls, I find 2 to 3 is pretty good. For under the chin, usually 3 to 4. What else? Side effects we talked about. Adverse reactions we talked about. Do I put it anywhere else? Not really, because, and I know YouTube they'll treat the bra fat, they'll even treat abdomen, but we have Cool Sculpting and it works better for a debulker, so I don't really put it anywhere else. But I do find people complain about they want this, and a lot of times you'll say, oh, maybe they need threads. If they have any amount of fat in their jowls, threads are not going to work. Threads are for skin only. Threads are thin, and they don't lift heavy things like fat pads. And fat pads are stubborn and they're stuck to what's underneath, so they're not going to move a whole lot. So if somebody has, you know, the dip here that they want pulled back and they do this and you think, oh, as they're doing this, it looks great. Threads have a great function, and I love threads, especially in the neck. Oof, it looks so good. Lower face, it looks great. Mid face, even, it looks great. But if you have a giant fat pad right here, you're not going to be able to lift. So I usually tell people for gels, it's a multimodal approach. You have to do multiple treatments with multiple different modalities in order to get the result you're looking for. And the first thing you really should do is Kybella. If they insist and say they don't want to have the swelling and all of this, I will sometimes throw a few threads in there just to placate them, but they usually come back and say, you're right, didn't go anywhere, or, you know, it improved for a little bit and then it came back. So that's the difference with threads, and I'll do a consult for threads video as well. So hopefully I covered everything.